Okay, I think we can get started. So, hi everyone, welcome to this evening's event, Regulation within the Aesthetic Arena, a panel discussion. So tonight I'm joined by a fantastic panel who are going to be sharing their thoughts on the lack of and need for regulation within the aesthetic arena. Our panel will also be providing an insight into our part-time online postgraduate certificate in skin aging and aesthetic medicine, a course which aims to provide students with an in-depth knowledge and understanding of safe, evidence-based aesthetic practice. This course is also something I look after in terms of student recruitment and support. So if you are thinking about this course and considering it for postgraduate study, our next intake is September 2022, and I'd be really happy to discuss how you can take the next steps with the University of Manchester. I'll be putting my contact details into the chat, so please do get in touch if you are wanting to have a bit of a discussion around your eligibility, the course itself, and how it really can help you in your career. So I guess first and foremost, I want to start with a couple of introductions from our panelists, please. So Rachel Watson, I'm going to come to you first. Hi and welcome to today's event.
Hi Daisy, yes, my name's Rachel Watson and I'm Professor of Cutaneous Sciences here at the University of Manchester. For the past 25 or so years, I've been building a research group which looks really at the fundamental changes which happen to skin as we age. So I'm delighted to be associated with this programme. I'm unit lead for the fundamentals of skin aging for our PG diploma programme, and I'm also the unit lead for our skin rejuvenation for the PG cert. So it's very nice to speak to you all. You're all very welcome here in Manchester.
Thank you, Rachel. Tamara, I'll come to you next.
Hi there, thanks Daisy. I'm Tamara Griffiths. I'm a consultant dermatologist in Manchester and medical director of this MSc in skin aging and aesthetic medicine. Although I'm a general dermatologist, I have an interest in aesthetic and cosmetic dermatology, and I'm the past president of the British Cosmetic Dermatology Group. I've also been very focused on raising standards and trying to enforce regulation in this extremely unregulated sector, having been involved in the KIO review of the cosmetic interventions, as well as setting some of the educational standards through health education in England for this sector.
Pleasure to be here. My name is Dr. Helen Graham. I'm a lecturer in skin aging and aesthetic medicine here at the University of Manchester. My research career has taken me, has kept a focus on the extracellular matrix aspect of the skin and how that changes with age, and it's a fundamental contributor to the ages we see, the changes we see in the aging skin. So my role is one of the programme directors on this PG cert in skin aging and aesthetic medicine, and I'd like to welcome you all here today.
Thank you all. It's great to have you here. So my first question to all of you is, what does regulation mean to you in the context of aesthetics? Helen, if you don't mind, I'll come to you again.
I think a key part of the issues that practitioners are currently facing is that there is a lack of regulation at the moment, which means that the patient safety is compromised. So what we're trying to do in Manchester here is to address the lack of formal training by providing a really comprehensive foundation knowledge around the skin, how it changes with age, and then how the treatments actually the mechanisms of actions of the treatments that we use. So we're not just providing, it's not a practical program which rattles through numbers of patients. What we are actually doing is providing you with the foundation knowledge so that you can understand the mechanisms behind the changes that we see in the skin and the mechanisms of action of those treatments that you will be using, and therefore you'll understand the safety much better and provide a better level of safe patient care.
Thank you, Helen. Rachel, I'll ask you the same question, please.
Yeah, I mean, Helen's absolutely right. It's about patient safety, so it's making sure that you are comfortable and you can safely practice and provide the best possible service for the person that's sat across the desk from you. Making sure that you understand what the treatments are doing, why they are beneficial to the individual, thinking holistically about that individual and not doing things by rote. So being able to understand the nuances of treatment and to do that treatment in a safe and effective manner.
Thank you, Rachel. And Tamara, can I ask you the same question?
Sure, of course. It's really a very complex question. What does regulation mean to me? Well, the problem is there is no regulation, or very limited regulation in this sector. And there's a very wide variety of practitioners, ranging from consultant plastic surgeon, consultant dermatologist, GP, dentist, nurse, other healthcare professionals, allied healthcare professionals, and then people with no clinical background at all. So because there's such a broad practitioner group, we really do need to set some kind of minimum standard for patient safety and for members of the public, because members of the public often don't understand the difference between maybe a GP with a specialist interest in dermatology versus a skin specialist who works at the department store beauty counter. So they're all considered skin specialists. So we're trying to provide some transparency. And cosmetic interventions were deregulated by the government in 2008. It was a move many professional groups fought, but there was a clear line from the government's point of view that if the indication of any procedure is cosmetic, then it's not going to fall under regulation by the GMC, by other professional bodies, or other regulatory people that control these things. So it really left an open door for runaway practice in the cosmetic, non-surgical cosmetic sector. So we've been trying to claw that back and at least establish some kind of voluntary registration where ethical practitioners will sign up to a voluntary register which declares their practice is aligned to set standards to make it more clear for the public. If they see someone who's on a voluntary register, then there is some assurance that they have met a certain professional standard in this area of practice. And part of this PG Cert, PG Dip, and MSc is to develop leaders in the field so they can provide evidence that they are working to the standards that have been agreed by the professional bodies.
Thank you, Tamara. That's really insightful. So in October last year, so in October 2021, a new law came into place stating that under 18s are no longer able to get Botox or dermal lip fillers in England. I guess this is, you can call it a milestone for the aesthetic arena. Do you think these rules go far enough? Tamara, I'll come to you first.
Well, we're at such a low baseline. Any kind of law is amazing. So as I say, in 2008, the whole area was deregulated. So we've been fighting tooth and nail to reinstate some kind of regulation. So the fact that there is a law banning procedures, non-surgical cosmetic procedures for under 18s is a milestone. Is it far enough? In my view, I think we should require mandatory regulation for people that are injecting and performing what essentially are medical procedures used for a cosmetic indication. So the procedures were developed really for medical indications, and the reason, the purpose for the procedure changed, but the actual process and adverse events are the same. So, the change in indication doesn't mitigate the risks or reduce the risk of the procedure itself. So do I think it's far enough? No, I don't think it's far enough, but I think it is a major milestone, and the fact that it's law is very strong. Now, how that's going to be policed, that's another question, but at least it's one step forward in a very long journey.
Absolutely, Tamara. And Rachel, I saw you nodding there. What do you think to the new law that came into place?
Well, it's baby steps. I mean, as Tamara said, anyone can set up an aesthetics clinic, and we've got to be able to provide the public with, I suppose, the confidence to go to practitioners who actually know what they're doing. So, I mean, I have a 17-year-old daughter. If the thought of her walking into a beautician's and being injected with something which can cause irreparable damage to that person fills me with absolute dread. So from a personal point of view, these laws are absolutely necessary. But as Tamara says, it's a small step and there's an awful long way to go.
And I would also add, cosmetic patients in general can be quite vulnerable. They can be quite blinkered to potential risks. They believe what they want to believe. And sometimes they need a little bit of balance, or someone who can give them an objective advice and opinion rather than try to sell them something. And I do believe young people are, particularly more vulnerable. They have a concept of invincibility. They're blinkered at what they want, and it hasn't occurred to them what the negative side effects could be, because they're potentially less experienced as well. So I think the fact that young people are protected is a big step forward, due to what I view as almost a double vulnerability in this area.
I mean, there's the issue around bioethics. Just because we can do something doesn't mean to say that we necessarily should do something.
And I think that's a real push in the course. So the program that we offer is not, as Helen said, just about technical skill. It's really about professionalism and behaviors and attitudes towards what you're doing, toward the patient in front of you, the business aspect versus the professional aspect, and how can you marry those two and work in an ethical way. So these are very complex issues that often just get missed. A big part of our program involves reflective practice, questioning what you do and why, not just in terms of injecting, but in terms of prescribing a certain medication. We focus on networking with other like-minded colleagues, so you can sense check yourself if you're not sure, because we also understand that lone practice or solo practice can be quite dangerous when people really have a blind spot and nobody's pointing it out to them. So the networking and access to academic resources where you can evidence check and investigate things thoroughly in a systematic and evidence-based way, as opposed to marketing-based way, is something that we really emphasize in the program, and is a huge advantage to our course.
Thank you, Tamara. Helen, is there anything you'd like to add from the kind of academic side?
I think just to really emphasize again what Tamara's just mentioned about it can be a very lonely practice as an aesthetic practitioner, and what this course does is it provides you with the tools to be able to go on and practice safely by, first of all, having your colleagues around you that you've graduated from this program will stay with you. You've met a group of like-minded people who have gone through quality training to enable them to make good decisions, and so you can use those as a network moving forward, but also the tools to continue learning, to continue to be able to as Tamara says, check the evidence base. So before you decide to embark on any new procedures, then you've got the ability to be able to look through the evidence base and say, do I believe that this procedure has got a good enough safety record? Is the evidence there for the efficacy? And you can make those decisions yourself and feel confident in your decisions, so that you know that you're making the best choices for the patient. So I think we're not only providing you with learning content, but we're providing with the tools for you to carry on learning and making your own evidence-based decisions moving forward.
Thank you, Helen. And to those listening, if you are interested, as I said earlier, in finding more about this course and kind of understanding whether or not it's the right next step for you, I'll put my contact details in this webinar today, so you can contact me and I can discuss those with you. Tamara, I'm going to come to you for this question. So it's been called for mandatory psychological screenings to take place ahead of treatment. So the reason for that is to understand a person's motivations and spot individual risks. Do you think this will be key to regulating the aesthetic arena?
I think psychological screening is important, for sure. Whether I think mandatory screening is going to affect regulation. I mean, regulation is really a separate issue. There is no appetite from the government to embark on mandatory regulation. So what we have is voluntary regulation. And we do have a set of standards for non-surgical practice that was established by the Cosmetic Practice Standards Authority, the CPSA. This was led by the dermatology groups and the plastic surgery groups as a standard that as we as professionals set ourselves against, and we would encourage others to. And within those standards, it does talk about psychological screening. I think the psychological screening required for an invasive surgical procedure is different from the psychological screening we would require for non-surgical practice. But I'm coming from an angle where most clinicians, as experienced doctor or nurse, we already have our antenna up for people we feel might be particularly vulnerable, might have body dysmorphic disorders. So I think psychological screening is an important part of all of our practice going forward. How it relates to regulation is actually a separate issue. You could use mandatory screening as a tool to kick someone off if there was some mandatory regulation, but there's not mandatory regulation, it's voluntary regulation. But as I intimated before, the cosmetic patients can be very complex from a psychological point of view and quite vulnerable. And it's years of clinical experience that help us develop expertise in this, but there are useful tools that can help us pick out some red flags.
Thank you so much. So I guess my question next to you all is, why do you think it's so important then for practitioners to gain a qualification which enables them to build a reputation within the field, but also is something that clients recognize and trust? Helen, I'll come to you first.
This is a really good question, because I think from the patient's perspective, they've got to be able to differentiate between those qualified and trained practitioners versus those without any training or qualifications. And at the moment, it's very difficult to be able to do that. So the reason that this exists is for the safety of the patients, but also we need to educate the public to enable them to make the best choices and to go to those people with a qualification and adequate training. So it's a two-way street. I think we need to keep communicating with the public, and we need to make sure that there is a qualification requirement, so that those patients can then differentiate between the ethical and safe practitioners.
Thank you, Helen. And Tamara, have you got anything to add to that?
Yeah, I think it just, again, it's for the reason is for patient safety. So that's the reason we do what we do, is to drive standards of practice up, ultimately for patient benefit and for patient safety. So qualification is required just as a kite mark. So patients know this person has had adequate training in the procedure they're engaging in. And at this time, it doesn't exist. Anybody can inject. It's why we have qualifications for anything else. Why does a plumber need a certificate to work on your gas boiler? It's ultimately down to the safety of the public.
Thank you so much. So I'd like to go back to the course itself. So the postgrad certificate in skin aging and aesthetic medicine. So it's a fully online course, it's part-time, and you've designed it to fit around work commitments and to support the professional development of qualified medical and dental practitioners. Rachel, I'm going to come to you. Can you tell our audience more about the course aims and how it aims to equip students with the skills and knowledge to practice safely?
Yeah, happy to. So this PG cert comprises 4 units, and each of those units addresses a certain area of aesthetic practice. Now, before we even talk about what we're going to do with the skin, we need you to understand the changes that happen to the skin as a function of aging. So the prerequisite unit for the PG cert is fundamentals of skin aging, and that takes you through age-related changes and changes due to sun exposure in the environment. So really, the bedrock is the understanding of the anatomy and the pathophysiology of what happens as we age, and having an understanding of what changes enables you then to build on that, to look at the treatments that you can use to ameliorate those changes. So the 2nd, 3rd and 4th units are more clinically aligned. So we have a unit on injectables, so again, Botox and dermal fillers. And again, that addresses the safe practice of those particular techniques, looks at contraindications, looks at what happens when perhaps something goes wrong, so adverse events. So to give you a broad understanding of what happens should things go wrong, and then what to do. And then the third unit is skin rejuvenation. So that really focuses on topical rejuvenation. So what can be done which is minimally invasive to improve skin quality and texture. And then the final unit focuses on laser and light therapies to look at the benefits that they might provide for the skin. So what we're hoping to do is provide our students with the knowledge and the understanding of a variety of techniques which holistically can improve the facial aspect of their patients.
Thank you, Rachel. Helen, I'll come to you. Can you give a kind of brief overview of the course and how it aims to equip students with the skills and knowledge to practice safely, please?
So I think, well, following on from Rachel's great summary there, I think that was in a nutshell, really. That's the learning content, but there's also other intended learning outcomes which are, as I've mentioned earlier, to enable the students to feel confident to make the decisions based on the evidence. So we do a number of different interactive tasks and group work where students discuss different studies on new therapies and decide amongst themselves whether they believe the evidence is robust enough for them to implement these new therapies in practice. We also, so we're appraising the evidence, so we're practicing that technique of really being able to critically appraise the studies in the field. So that's a really major aspect of the programme that we hope the students will feel that enables them to make the best decisions for their patients. And another, as I've mentioned before, is that network. So once you've graduated from this programme, those students that you've gone through the programme with, you'll have made contact with, and it will be a support network for you of trusted individuals that you know have had training in this area and that you can trust for a second opinion. So I think they're really key. They're really key skills that you pick up alongside all of the learning content as well.
Thank you, Helen. And you talked there a little bit about network and having a network while studying on the course, but also after. Are you able to share just a little bit of an insight about our current students studying on the postgraduate certificate, so their backgrounds, and Rachel, Tamara, feel free to add anything as well.
Well, that's another great point, that our students are all medically or dentally trained. So they will have had been qualified in medicine or in dentistry. So that means you've got a number of disciplines that all bring different perspectives together, and it's a really valuable learning tool because you've been used to working and looking at the situation from your perspective, but listening to the other students on the programme will really help you learn that there's another way, there's more than one way of addressing this problem, or coming up with a treatment plan, or it's a really interesting set of disciplines that we have. So we have had A&E consultants, we've had GPs, we've had dentists, we've had ophthalmologists. So it's a great mix of disciplines to enable to spark off great discussions between the students.
Thank you, Helen. Rachel, Tamara, is there anything you'd like to add about our current students?
Only that it's nice and fun learning environment. As you say, it's very broad. Okay, it's a very broad discipline. There are lots of different types of people who are working in this space, and as Helen says, it's a fantastic opportunity to learn from peers who may approach the same problem in a completely different way. So the diversity of our cohort, I think, is an advantage.
Absolutely. And I think because this course is obviously taught fully online, it gets people connected who may not have been connected if it was kind of face to face. So I think that's a really good aspect of the course. It brings a lot of people, not just from the UK, but globally together in a virtual space, really, to, like you said, learn from each other and kind of spark off great conversations. So my final question from me to you all is, what more do you think needs to be done? And I think there's a lot more to be done within the aesthetic arena when it comes to regulation standards and patient safety. Rachel, I'll come to you, please.
Well, I think we just have to keep pushing government, really. As Helen and Tamara have already mentioned this evening, it's about education on both sides of the fence. So educating the public to understand that there is a variation in the level of practice that one can submit themselves to, and that actually we need to be encouraging patients to go to those practitioners who have a good understanding of the challenges that they would like to be managed, and then from sort of the more high level side of things, it's about, again, keeping the conversation open with government and making sure that, you know, we're encouraging our students to register on the JCCP register, and making sure that government knows that we are raising standards in the arena. And we just have to keep moving forward. I think it's baby steps. It's taken a long time to get to where we are now, but there's traction there, so we need to just keep going.
Thanks, Rachel. Helen, your thoughts?
Fully agree with Rachel. I think what we need to ensure is that the practitioners that are in the industry are applying the same rules to this cosmetic arena as they would do in their professional discipline. So you wouldn't just go out and treat without any training in any other discipline. And so that needs to be across the board. So applying the same rules that you would do in your discipline to this arena. Again, public education as well, so ensuring that the public understand that there are adverse events that can happen and there are risks involved in this. And just because, you know, everybody seems to be wanting these treatments doesn't mean to say it's not a really big decision. And so, you know, the practitioners really have a big responsibility here. And I think we need to make sure that they're supported, they're trained, they're making the right decisions. So putting in mandatory training would be a great next step for everybody that's in this sector.
Great, thank you, Helen. And Tamara, to finish from you, please.
Yeah, I agree with all, and I would just add, the professions need to work together and continue to collaborate. So we need to move away from territorial thinking, us and them thinking, and understand we're all in this together with a similar agenda. The key agenda is to improve standards for patient safety. So if we have that as a goal in mind, sort of all the other things become less important. But if we work collectively, we understand this increases our voice. We need to work collectively as clinicians. We need to work collectively with industry to get them to understand our concerns and overlap the agendas on patient safety and standards. And we also need data collection on adverse events because it's through the data collection that the government will listen. So that's going to include people who don't practice in aesthetics, so people, A&E doctors, GPs, other people who don't practice in aesthetics but see complications, and get them on board to MHRA reporting or some kind of adverse events common area where we can collect the data and move things forward. And the sector has been so disjointed in the past, and this is why it's been difficult to move things forward, but we are working more collaboratively, and I think it's really critical for any kind of gains in the future that we continue to do so.
Thank you, Tamara, and thank you to you all for providing such a great insight into regulation, the lack of and the need for more regulation within aesthetics. I've had a couple of questions from the audience, if you wouldn't mind me kind of pitching those to you. The first one being, how do patients go and find a trusted provider or practitioner? How easy is that to do? And I mean, whoever wants to answer that question, go for it.
Well, this is one of the reasons we have the JCCP register. So I think it is really difficult for patients, and word of mouth can go so far. But I've had a lot of patients that come to my NHS clinic saying, I went to someone who's supposed to be trustworthy and have complications. And it's not to say, you know, complications do happen even in very qualified hands, but I think it is very challenging. I would look to see what their core professional qualifications are. So are they a doctor? Are they a dentist? Do they have a specialist qualification? Are they a plastic surgeon? Or are they a dermatologist? Are they, you know, maxillofacial surgeons? So some of these higher level postgraduate training programs include cosmetics, some cosmetics in their core curriculum. So GMC specialist registration would be one area. But because the practitioner group is so diverse, asking about experience, asking about complication rates, asking if I have a complication, can you diagnose it and can you treat it? And then this is one of the reasons we're pushing for the JCCP register. There's over 300 entrants already. So to gain entry onto that register, the practitioner has to comply with the CPSA standards. So if someone is on that register, is volunteered to be on that register, that means their practice is aligned to the standards set by the CPSA. So that is a good way to find a practitioner as well. But I would say to patients, listen to your gut feeling. If it sounds too good to be true or so cheap you can't believe it, then, you know, obviously that's a red flag. If it's someone on Instagram, which we see, you know, that's here one day, gone the next, those clearly, obviously not good things to do. But as I say, these patients can be vulnerable and they believe what they want to believe.
Absolutely. And Tammy, you mentioned Instagram then. Just a question from me. Do you think social media and the rise of social media and young adults kind of using social media, do you think that's kind of caused a lot of impact to kind of the regulation within aesthetics?
I think social media has definitely impacted the cohort of young people we see going for these procedures. But, you know, improving one's looks and trying to look younger is something that's age old, you know, it's from ancient times. But altering one's looks in youth is I think, very influenced by social media. It's very hard to regulate people that come on social media. They're here one day, gone the next, and they're not doing anything technically illegal, but, you know, it's really not good practice because the patients have complications. You know, I see them in my NHS clinics and we don't even know the qualification of the person that treated them or what they had injected. So that is an area that needs a long way to improve, but there are issues with social media in many other sectors as well.
Absolutely. Thank you, Tammy. And there's a lot of international differences when it comes to regulation. How does England compare to kind of, if we look at it from a global perspective?
Well, from first world countries, you know, the UK is very poorly regulated. In other countries in Europe and the US and the Far East, you know, at least clinicians, it has to be clinicians. In many countries, it has to be doctor, you know, sometimes specialist, but at least doctor, and at least clinician, nurse. But in this country, it can be anyone. So I would say it's probably one of the worst in terms of first world healthcare systems and the lack of regulation, which is, frankly, I find perverse, but that's the way it is.
Thank you, Tamara. Helen, Rachel, is there anything you'd like to add to any of those questions before we wrap up today?
No, I don't think so. Apart from saying that, you know, the whole aim of this programme and the suite of programmes that we offer is to provide our students, our practitioners, with the best possible foundation knowledge that they can go on to be safe and successful practitioners, and, you know, help the whole community raise standards and improve patient safety.
Thank you, Rachel. Helen, I saw you come off mute. Sorry, I don't know if you wanted to add anything.
Yeah, I just fully support what Tamara and Rachel have said, and if we can flood the market with highly trained practitioners that then we're training the trainers, that would be the ultimate goal, to raise those standards, so that we can make sure that everyone's passing on their knowledge and keeping patients safe.
Absolutely. And just to mention one of our current students who transitioned from dentistry to cosmetic aesthetics. So we are actually doing that and helping our students kind of get that evidence-based knowledge and backing and confidence behind them. So to all you listening, if you are interested in this course or the suite of courses we offer, please do get in touch. I can kind of talk to you over Zoom about your background in a lot of detail and kind of help you make that decision and hopefully join the University of Manchester and become a confident kind of leader in the field, really. So Helen, Tamara, Rachel, thank you very much for joining me this evening. It's been a pleasure, and thanks for sharing your thoughts, and I look forward to seeing you all again soon.
Thanks so
Thank
much.
you.
Everyone, and
Bye.
welcome any
Thank you.
Bye.
Thank you.